Fantastic. Everyone, hi.
Hi.
Who all has been here before? Raise a hand. Fantastic. So you guys remember when it was only a couple of people here, and now it's a full house. So this is good. We're very excited to have the wonderful doctors here today. Excited to see how these BHL presents are growing, how the community is growing. If you guys are not part of our WhatsApp community, please make sure to join. It's free. You can get a lot of this information out there as well. A lot of these doctors are on there as well. For anybody who's on the Zoom, we will record this, and for anybody here, we will be recording this, and we'll put it onto our YouTube channel as well. So if you want to share this with other folks, feel free to do so as well. Before we get started, the intention here today is to talk about ozone. How many folks have tried ozone? Raise your hands. Okay, not so many. So this is going to be very exciting for you guys to learn more about the details of how each of these doctors are using ozone therapy. The intention here, we have some questions and some slides prepared, and then afterwards we'll open it up for questions. So I would just ask if we can hold your questions until the very end, and then with time, then we can ask away. Does that sound like a plan? Okay, great. So who we have here today? So we have Dr. David Pakula, licensed acupuncture physician and diplomat of Oriental Medicine. You've been using ozone for about 10 years.
10 years, yeah.
In your practice.
Yeah.
So we'll talk about how he's been using ozone in the practice and for a number of different uses. Dr. Maya, you are a biological dentist and you use ozone in your dentistry clinic.
Yes.
Correct. So if anybody's ever had little cavities, they might be able to be zapped. Maybe, we'll see. We'll talk about that. And then Dr. Sienna, ER physician and now longevity specialist. I don't know, so many different things you could be.
No title.
No title, exactly. But using ozone in more of the longevity realm, the regenerative realms. So we'll talk about all the different use cases of how you guys are using it. So one thing I just want to call out about ozone is we had a couple of hands that were raised to say ozone, you've tried ozone. But in reality, all of you guys have smelled ozone. It's that smell that comes from the rain, after a lightning storm. So if you've had that smell, you kind of know what ozone is, right, or what that smells like. Now, the idea about ozone, and when we titled this, we were saying ozone is this molecule that's a hidden, that nobody knows about. Why is that? There's different reasons. One of the reasons could be that if you inhale it, it can be toxic to the lungs, so you have to be careful. And over the course of today, we're going to talk about the nuances of ozone, from low dose to high dose, so how you really want to think about ozone so that it is not toxic to the body. The other nuance is that there is regulatory issues. There's things that kind of the FDA has not approved it. However, in Europe, it is used widely. So we don't want to get into the politics of it. That's not the intention of today. The intention is to really understand the health and the health benefits that you could receive if you do ozone. So with all of that being said, let's get started into the panel. So Dr. David, you've been using it for 10 years in your practice.
That's right.
Can you, and just be careful that, let's get the microphone.
Yeah.
Can you tell us, and we have some slides prepared as well,
Sure.
about how the history of ozone, the use cases, just walk us through how you've gotten interested in this and how you're using it.
Sure. Well, we were introduced to it about 10 years ago, and at the time, ozone was really becoming it was just basically starting to become popular. And now it's really grown to the point where people all over the world are using ozone for some fantastic medical therapies. But so let's talk about what is ozone. Let's start with the basics. So Dasha already mentioned that a lot of us already know what ozone is without really knowing what it is, because we've experienced the smell after a rain. So what happens is that ozone is, the chemical name of it is O3. Oxygen is O2, so it's a type of oxygen, really. It's just that there's one atom different. And that one atom makes a huge difference because oxygen is a very stable molecule, whereas O3 is very reactive. And the reactivity of ozone is where the magic comes in, because it interacts with chemicals inside the human body, and that's what produces the magic. So we've known about ozone since ancient times, really. The name ozone comes from a Greek word ozane, which means smelling gas. So it's been known. Now, when we talk about the history of ozone, I guess we would start in the 1800s. And in the mid-1800s is when they started actually making ozone generators. Now, an ozone generator does the same thing as what happens in the atmosphere. The way ozone is created in the atmosphere is the electrical discharges in the atmosphere interact with oxygen. It breaks up the oxygen molecule. When it comes back together again, it forms ozone, which is, as I said, is O3. So an ozone generator does that inside a generator. And so we can actually manufacture ozone that we can use with patients, right? So the ozone generators started to be made in the mid-1800s. Nikola Tesla, famous inventor, he actually got the first patent on an ozone generator in 1896, right? In World War II, they were using ozone as an antimicrobial. They were treating soldiers in World War II for wounds, that sanitized wounds, and for gangrene, et cetera. And I would say that the first line in the history that you see on the slide there talks about the history up until World War I. And at that time, ozone was mainly being used for its antimicrobial properties. Incidentally, ozone was also being used for industrial purposes because of its antiseptic capacity. It was used to purify water. It was used as an antiseptic, but it was not until starting in the second half of the 20th century that scientists and doctors started to understand that there's a whole world of other uses for ozone inside the human body for therapeutic purposes. And that's when things like treating the human blood started happening. We found out that ozone could produce an antioxidant response if used in low doses. And as we go into the history, you can see that in Russia, for example, they started developing ozonated saline. The German scientists and doctors made great contributions to the science of ozone and the medical uses of ozone. And as we get into the 21st century, we see that there's a growing amount of medical research and scientific discoveries about how to use ozone. And around 2010, there was established standards for the use of ozone as a therapy, as a medical therapy. And that's called the Madrid Declaration. And that's a document, it's a consensus document, meaning that doctors and scientists from all over the world came together in Madrid, and they all decided on standards for dosages and uses of ozone as a medical therapy. And so now we have a mountain of research. We have hundreds and hundreds of medical papers and studies done. We have standards that are used for the safe and effective use of ozone as a medical therapy. And it's becoming more and more widely accepted. There are some legal issues. Important that Dasha mentioned, the FDA has not approved ozone, but keep in mind the FDA does not regulate medicine in the United States. The FDA can only regulate devices and drugs and whatnot, but ozone is not a drug. The regulation of medical practice is regulated by each state, and so you have to look at what state you're in, and in most of the states in the United States, the use of ozone as a therapy is totally legal and it's approved. So there's no problem. Like in Florida, for example, absolutely no problem with a qualified medical professional to use ozone in their practice. So let's talk a little bit about how does ozone work, okay? So we've talked about the antimicrobial properties of ozone. But that's only one thing. But it's important to understand that. So the reason why ozone works as an antimicrobial is that it's able to break down the cell walls of microbes. Microbes is anything from bacteria to viruses to funguses. And the great thing about that is that while ozone can kill microbes, it doesn't damage human tissues because the human tissues have antioxidant capacity. So they can resist ozone, they can adapt to ozone as it's introduced into the human body. So that's a very important thing to understand. The other uses of ozone, and we'll get into this in a lot of detail today, but the ozone basically is an oxidant. We talked about how it's reactive. It reacts with tissues in the body. And so the main thing that it does is it's an oxidant. I'm not going to get too much into the biochemistry. I think that would be a little bit boring. But the main thing to understand is that when you use ozone as an oxidant, if you use it in low doses, it actually produces an antioxidant effect. And we've all heard about antioxidants, vitamin C, glutathione, whatever, we know about this. But what a lot of people don't know is that ozone is the most powerful antioxidant agent there is, because it's actually using the body's own antioxidant capacity, right? So that's the strongest antioxidant you can get. And what is antioxidant? We've heard about this. It's anti-aging. What is aging? Aging is oxidation. Mm. So ozone really is the quintessential anti-aging therapy, right? So a little bit more about how it works. You know, when it comes into contact with blood, for example, and other human tissues, the tissues, they have an adaptive response, right? It's important to understand that we have to use ozone in low doses, because if we use it in high doses, it overpowers the antioxidant system and it has you could say, a corrosive effect on the body. You don't want that, right? You want to use it in low doses so the body reacts to it, adapts to it, and actually produces an antioxidant response. And more than that, it also modulates the immune system, which is a beautiful thing, because it doesn't just stimulate the immune system, it doesn't suppress the immune system, it modulates it. And that's the beauty of how ozone works. It stimulates some immune cytokines, and it has a suppressive effect on others, the bad ones that you don't want. So it has an anti-inflammatory effect, but it can also have the effect of stimulating the immune system where it needs to, and when it's used in the correct doses, and we'll get into that. So it has amazing properties. It works on several different biochemical pathways in the body, and some of the benefits are as follows. I can't even talk about all of them because there's so many, but we've talked about the antioxidant effect on the body, which is amazing. We've talked about immune modulation. It also increases oxygen utilization in the body and blood flow, which is an amazing thing. It increases mitochondrial function and ATP production. It has an anti-pain and anti-inflammatory effect. And these are amazing, amazing, amazing benefits of ozone. So next I'm going to be talking about some of the methods of administration of ozone and the difference between using ozone as a locally and systemically, right? So what do I mean when I say that ozone can be used systemically versus locally? So systemic use of ozone means that we're basically introducing ozone into the blood, okay? And the blood goes everywhere. So it treats the whole entire body if it gets into the blood. Local treatment using ozone means that we're introducing ozone to local tissues where it only has an effect on local tissues, right? So it's important to understand that first, and then we'll talk about different methods of administration. So when we talk about systemic applications of ozone, we're talking about treating the blood, but this can be done in different ways. So we can use ozone directly into the blood, and sometimes we call that major autohemotherapy or minor autohemotherapy. Autohemotherapy means we're treating our own blood. Auto means self, and hemotherapy means therapy for the blood. So when we treat the blood, usually what we're doing is we're extracting some blood from a patient, and we're injecting ozone directly into the blood, where it mixes with the blood and it does its magic, and then we return the blood into the person's vein. It's an intravenous procedure. Minor autohemotherapy is along the same lines, but what we're doing is we're withdrawing a very small amount of blood, and we're ozonating it, and then we're injecting it into the muscle, like an intramuscular injection. And that also becomes systemic and has all the benefits. We use that mainly for stimulating the immune system. Major autohemotherapy is used for many, many different things, for chronic degenerative diseases and all kinds of things. We'll get more into that, but just to give you an idea. Other methods of systemic administration of ozone would include things like an ozone sauna, which you may have heard of. It's wonderful. It has a detoxifying effect on the skin, and it's very pleasant. You're sitting inside an ozone chamber, and you're enjoying the wonderful ozonated steam, and people love it because you don't feel hot. The ozone actually cools down the steam, and it's a wonderful feeling to be inside an ozone sauna. And it gets into the blood because of all the capillaries that are inside the skin that absorb the ozone. So it gets into the blood that way. We have rectal insufflation, which is sometimes used as a systemic method of administration. And what else? Am I missing anything? I think those are the main methods of systemic administration of ozone. So local administrations of ozone, this can be anything from using it on the skin. For example, we have something called limb bagging, which is an amazing thing. We've had patients with, for example, sores that just won't heal, like diabetic patients who have sores that they just because of the diabetes and the poor blood flow to the limb, they just won't heal. And we've gotten amazing results where we put a plastic bag over the limb, and the ozone gas comes into the bag, and it just helps to regenerate the tissue and to kill the bacteria and help it heal. And so there have been amazing results. Sometimes we use this together with a hyperbaric chamber, which also increases the circulation, or we use it with systemic ozone, which does the same thing, and they're amazing results. We can use ozonated oil, where we ozonate the oil and we apply that directly to the skin. Can be used for fungal conditions and whatnot. It can be various things. Then we have insufflation of ozone, where we're either introducing it into a cavity, like into the sinuses. It can go into the ear. So those are the main things. But so it has amazing abilities to help with sinus conditions, for example, or for ear infections, things like that. Then we have other local injections are actually injecting the ozone into the body. So this is not the same as doing an intramuscular injection. This is where we're injecting ozone into a joint, for example, where it has amazing anti-pain and anti-inflammatory effects. In our clinic, Vita Health Regenerative and Wellness Center in Pembroke Pines, we have a procedure we love to do, which is injecting the ozone into the sacral canal. There's actually a space between the tailbone and the sacrum. And if you inject the ozone into that space, it actually goes into the sacral canal. It goes up into the lower spine, into the lumbar spine. And we're able to treat things like lumbar stenosis, herniated discs, all kinds of problems. And it's a very safe procedure, and it's very simple, and yet it has really profound effects, healing effects on these kind of conditions that are very difficult to treat otherwise. So these are some examples of local treatment of ozone. I'm sure I left something out because there's so many uses for it. It's almost like a universal treatment for almost anything. So the next thing I wanted to talk about was some general guidelines on dosage. Now, I mentioned that ozone is used in low doses, right? But within the range that we consider to be low doses, there are some nuances here on how to use ozone, right? So within that range, there's lower doses, there's medium doses, and there's higher doses of ozone. When we use the lower doses, we use that to stimulate the immune system. And we have some patients who have a weak immune system, or they're recovering from an illness, or they have a chronic illness, where they just don't have the resources to handle a higher dose of ozone. Their immune system needs some help. And this is the perfect type of thing. For example, we can't say that we treat cancer with it, but we can say that ozone stimulates the immune system so that the person who has cancer has a better chance of fighting the cancer. So we're not using it to directly treat the cancer itself, but we're using it as a method of improving the person's immune system so they have a better chance of fighting it. So these are the low doses. The medium doses we use for immune modulation, for its antioxidant effect. It's commonly used for chronic degenerative diseases of various kinds. High doses we use mainly because it has more of a slightly immune suppressive effect, and we don't want to suppress the immune system too much. But sometimes when we have people with autoimmune diseases, for example, using the higher doses is perfect because it tends to calm down the immune system. It doesn't suppress it like immune suppressive drugs. The problem with that is that a person has a flare-up of an autoimmune disease, and they might have severe inflammation of a part of their body where the immune system is attacking itself. That's what autoimmunity is. And they need some help. We need to calm down the immune system to help with their symptoms so that they don't have so much inflammation. And but at the same time, unlike the immune suppressive drugs, using ozone doesn't suppress the immune system. It doesn't make it any weaker. It just regulates it so that the symptoms from the autoimmunity are controlled and managed better. So I think that's
that
my part
you
of
have
the.
definitely been doing this for many years.
Well, it's an amazing thing. We have gotten some amazing results in our clinic with it, and all our patients love it. And it can treat so many things in ways that are just, it amazes me every day to see the results that we get with patients. That's all I can say.
Yeah. So how many of you now want to try it? Thank you. I know I know that's a lot, but we wanted to have you really understand kind of the history and then the various use cases, because it sounds like it's a silver bullet, which it's not. We also want to call that out. This is not a silver bullet, but it can add to your regimen. It can support.
It's another tool in our toolbox. That's an amazing tool that we use. Yeah.
Exactly. So I'd love to learn a little bit more, Dr. Sienna. So you had mentioned about insufflation and the various different. We'll just pass you the mic, and just when you hold it, to make sure it's.
Mine's turn.
We're gonna go to. So in terms of insufflation versus EBU, can you tell us a little bit more about the difference and when you use it for what case?
All right, completely different. I don't know if I need to add anything after that beautiful, I know, mic drop.
There's a lot more to say.
Yeah, I know, but then it just gets more complicated. So insufflation really is, as you were saying, if we can use a localized effect. Now, in my opinion, everything can still have a systemic effect if you are introducing this into the body. However, because of the cavitary type areas that we are using, it is very effective for that area that tends to be a little bit walled off. And particularly for the sinuses, which is really, you're going to be diving into a lot, it's hard to reach systemically. But through the blood, those areas are walled off for a reason. So that's where we get fluid buildup, where we get chronic inflammation, chronic infections, which can be a source for chronic inflammation in general, breathing issues, the gamut. The nice thing about the nose and the ears is it allows a direct communication to not only all of the sinuses, which is your upper teeth, your maxillary, your frontal sinus, your maxillary sinus, also directly into the brain and the blood that is affecting the brain. So not only are we helping with dental issues, actually, but sinus issues, ear issues, and then brain fog, migraines, any scope of headaches, because it is helping with the inflammatory process that is the primary contributor to all of those. So I've had it is probably the most adored in this place, just because it has such an immediate effect. And people come to me and they say right after, because that's what it's like to breathe. And for the first time, they can actually take a deep breath. Of course, then that night they're like sneezing like crazy and they're clearing out all the stuff that's been there for Lord knows how long. But it has an immediate effect and a prolonged effect. It's one of those that is very safe to do frequently. And I do want to make sure that one point that is driven home, it's never a one and done on anything and nothing in isolation. Again, this is a tool that works within the scope of what's going on with the body at that point in time. And our bodies are always in a rhythm. As you know, sometimes things get worse before they get better. And so there's a process of how the body's going to respond, which is why repeated exposures based on time and frequency, which also is based on the doses that they're getting, the route that they're getting it, and that. So understand that just like as our body goes through the disease process, the healing process is also cyclic in a sense. So just like you're going to feel maybe a little bit worse after a few hours, after things are mobilizing and you're going through boxes and boxes of tissues, 5 hours later, you're like, oh my God, my head is clear. Or you might get the immediate effect. But understand that the reason I love this one is you get a great localized effect. And in fact, if I can get parents and their kids, and if I can get this into urgent cares and places, it actually will be ideally a first-line treatment for ear infections, which usually aren't like a localized bacterial infections. Is usually pressure from a viral or something seasonal, and it is as effective, if not even better, than antibiotics, and you're not going to mess up your gut microbiome and all of the other downside effects of taking systemic antibiotics. Just like they were saying beautifully that if you do bagging in that local area, you are curing up an infection. Same thing if you do in the ears and the sinuses without having the effect on our systemic system, which is another beautiful thing. It doesn't hurt, it's passive. So that's insulation, which we can do today if you want, because that one's easy to do. Do you want me?
How long does insufflation take?
By the time I draw it up, it takes literally total ears and nose, we're talking 4 minutes. And then maybe a couple minutes to draw it up. So you're in the office for 10. And that's with a lovely hug and check-in and the wiping of the nose on the way out. So it can be very, very fast. And that's one you can literally do every day. I would also recommend giving a little bit of breaks, but it's something that is able to do more frequently. And ozone, as also as mentioned, it acts immediately. That third oxygen is just waiting to interact with something. So it has an immediate effect, and then the cascade that it initiates is the prolonged effect. So ozone is out of the body or out of its effect fairly rapid, almost immediately, but the downstream effects is what the body now has the capacity to do something with, which is where the magic really, really happens.
Perfect. And you want to talk also about Ebu?
Okay, now we're talking, okay.
So we're
The
going from
complete
local to
opposite.
systemic.
Yeah, the complete opposite. So, as Dr. Pakula alluded to, there are many ways of doing the systemic form of IV ozone. And we're talking IV saline, we're talking the major autolymic unit, which is basically taking out a specific portion of your blood, introducing ozone. It does what it does, and then we're reintroducing that into the body. Okay. If you jumped a few generations the most current form that they have created is still, ironically, low dose. It's just done over a continued point of time for an hour of a continuous infusion where your blood's being taken out in a dialysis format. So you're hooked up, you got 2 IVs. It's coming out one side, it's going through that generator that he talked about. Well, actually, the oxygen's in the generator, and the generated ozone is in communication with a filter. Okay. I want to clear up the confusion around the filter. It is not filtering anything. In fact, it is switched upside down, and its main use is as a very, very large surface area. So if you take little filaments of a filter and you spread it out on a long sheet, you have a very large area where you have the blood as it's sitting with I say ozonated oxygen, right? So you have a very oxygen-rich and ozone-rich area that your blood is interacting with. And it does, by default, because you're creating a cascade, some of the things that there may be some byproducts that you'll collect into a little canister, but it by definition is not filtering out metals or things like that. And there's a lot of miscommunication, I think, out there on the internet. Even doctors are saying, hey, look what I've extracted, and that has not been proven, and that's not the case. If something comes out, it's just by accident, in a sense. It's not the process. It is creating a very large area that your blood has a very safe chance to interact with this concentration of ozone. And then the thing about EBU is it also has an extra component outside of what ozone does, which is a photobiomodulation, which is a photo, light, bio, body modulation to modulate something. So light has various frequencies in it, and each of those frequencies has a biological effect on the cells. And one of those beautiful actions is antimicrobial itself, and also modulating the immune system. So it's getting a whole nother aspect. So once you've kind of exposed it to this ozonated, oxygen-rich blood, it then goes through another fact of just kind of like an extra kill, an extra immune modulating effect, and then it goes back into the body in a nice smooth circuit. So it's not a push-pull, which some of the passes does. Also doesn't take a long time. It's a 50-minute circuit. 50. And it is the equivalent. I wanted to quote one. I was introduced to another fact, so I would want to fact check exactly how many treatments this is equivalent to. I was initially taught that it's equivalent of a 10 pass, which is taking out some blood, ozonating it, put it back in. The gold standard for what was considered high dose, but it's really low dose over time, is a 10 pass. But that can be pretty, in my opinion, caustic, I guess, to the veins. It's a lot of pressure. You're pulling stuff out, you're pushing it back in, you're taking stuff out, pushing it back in. Still effective, but I think it's a little extra stress on the vein that may not need to happen if we have another modality. I don't like to badmouth any modality because I think all of them have effect. I think there's a smoother way of doing it, and that is with the EBU. I'm throwing out a lot of information. I don't want to lose anybody. So is that common something? Okay, so I'll pause there. So that's a systemic, that's like the Mac Daddy way of getting a systemic version. And then there's the ozone insufflation.
So when would you use EBU for what types of clients?
All of them, to be fair. Now, I may not start somebody with it for all 50 minutes. We may even just do a shorter time period so they're not exposed to the quantity of ozone. Or I might start them with just a one pass depending on if their body needs if it's already kind of on high alert and needs a little bit of support. But okay, so the main ones, the main categories are your autoimmune that we talked about, which is just a big bucket of your body, which is a pandemic now, and that's a whole nother conversation of why it's such a pandemic. But for the most part, most of our bodies are on high alert. Our immune systems are just so overtaxed. And so in that case, it's good for everybody. But if somebody is actively just in a flare, we'll say, definitely would use them in that case. And again, never a one and done. cancer, and anything in that chronic nature. And chronic usually means there's something that's always brewing that we haven't gotten to the bottom of yet. And for performance, and kind of like that anti-aging effect that you talked about, this is a primer for the body. And so you are getting all the benefits of the light, and you're getting the benefits of basically kind of a cleanup. And so even just anti-aging, and then your athletes. Bicyclists love this because it is that stressor and that oxygen. I wouldn't do it definitely before a match or a game or a meet or whatever form of performance they're about to do, because your body needs to acclimate and create that downstream antioxidant and resilient effect. But honestly, it could be for anybody. It just depends on where I would start with the duration of the treatment and for how long.
Beautiful. So it sounds like, both
I just want to make sure
Dr. Pakula and Dr. Sienna, there's so many systemic ways that we can be using this. Dr. Maya, I would love for you to talk about how this can be used for the oral microbiome, for the dental cavity, how you're using it in your biological dentistry practice.
Okay, great. Thank you guys so much for having me here. Thank you everybody for coming, everybody watching. And I sit between two very amazing practitioners, and I'm so humbled to sit here between both of you guys. And that was just an amazing explanation of it all. In dentistry, we are using ozone more of a localized effect. In dentistry, we fight pathogens all the time. So the bacteria that causes decay, the bacteria responsible for periodontal disease, the bacteria and the bad proteins involved in an abscessed tooth with a chronically infected root canal. So when it comes to cavities, if a patient has a very small cavity, an incipient lesion still within the outer part of the tooth, we can actually take some ozone gas at a specific dose, and we can insufflate that beginning part of the cavity to prevent the patient from needing to have a filling done. All the stars need to be aligned, and like I think both of you guys alluded to, it's not magic, but if we go in and it's the right type of cavity and the patient is doing the right thing as far as nutrition is concerned, because nutrition is very important, we can do a couple of sessions with some remineralization like hydroxyapatite and not ever need to drill into the tooth. As far as I'm concerned, the minute we drill into a tooth, that starts the death spiral of the tooth. No offense to any dentist in here, but I have learned along the way, less is more. So we have to try to be preventive, and ozone is one of the greatest tools that we have to stop incipient lesion. Has it happened where we've done a couple of sessions and the child promised that they weren't going to eat processed foods, but they still ate processed foods and it was still a cavity at the end? Yes.
They promised that.
They promise a lot.
Their parents were bribing them.
Yeah. And then in which case we have the opportunity then to treat the cavity via laser instead of a drill. Okay, which is much more, basically we're using light to take away the decayed tooth structure instead of drilling with a high-speed drill. The other thing that we can do is treat periodontal pockets. When a patient has periodontal disease, the teeth are surrounded by gums and there should be some very little spaces. But this different type of pathogen, different than what causes decay, is responsible for that periodontal pocket. We clean the pocket, we cleanse the pocket, we clean. It's still important to get your cleanings done. But then instead of putting an antibacterial agent in there, we can use ozone and literally insufflate to clean out, wipe out that type of pathogen that's living inside that pocket.
Use gas or
gas. We use both. In the practice, we use gas and we use water. There are different indications. If you already have a very deep cavity, in my world of biological dentistry, we want to try to avoid root canals as much as possible. And so what we do is we do selective caries removal. So we remove everything outside of the nerve. We don't get into the nerve. And then we take the ozone and we literally wipe out the remaining bacteria involved. And we at least give the chance of the tooth to stay alive, to stay vital. We have certain protocols that we follow. We have to make sure that the tooth is still alive and doing well before we do that. I'm not going to bore you guys with the details, but that's a chance that we have to avoid root canal treatment, avoid major treatment as much as possible. We can also use ozone insufflation in the ears to help with TMD, joint issues, which is many people suffer from. And when we're doing biological extractions, we will always use ozonated water to clean out the socket. We do that with something called sweeps, where the tooth gets taken out, the periodontal ligament gets cleaned out, then we put in the ozonated water inside the socket, and we take the laser and we put the tip of the laser inside, and we pulsate the ozonated water inside the socket to wipe out the remaining bacteria that's there, and then we start the process of building up on top of that. So our use in dentistry is more of a localized use, but I'm so excited about it because we can help to prevent patients from needing major dental treatment. And it's a wonderful tool that the body loves. The body doesn't see any harm in ozone. It's very, very safe to use. Actually, my mother, who was also a dentist, told me that way back, my grandmother's time, my grandmother's time, they were using ozone to treat periodontal disease back in so this is not something new. It's something unusual to the United States, I think more than the European countries. And I'll tell you why, in my opinion, not to get too political because we agreed that we wouldn't.
That's another day.
It's inexpensive. It's inexpensive. There's no patent on oxygen. There's no patent on ozone. And there are more than 117 documented treatments that ozone can help to cure. But pharmaceutical companies probably wouldn't like to know that 100 and more treatments can be treated with a simple ozone generator and using oxygen. So that's as political I'm gonna get. I'm sorry. I think it needed to be said.
Glad you said it.
Yeah. And so, that's my world with ozone.
Perfect. And you touched on ozonated water, and also I know that you use ozonated oil. Can you touch on those two things as well?
Yeah. So when we want the ozone to stay for a longer period of time, because ozone, once it touches something, it's gone, it's done. Once it touches the bacteria, it's killed. And we have to constantly be ozonating water in the practice because once it sits back there, guess what? It turns back into oxygen, right? So with oil, it lasts longer. So when you ozonate oil like olive oil or avocado oil, whatever it is, if it's a coconut oil, it's a safe carrier for the ozone, which allows the ozone to last longer. It actually becomes instead of ozone, it's a ozonide. It's an ozonide when it's in oil.
You stick the tube into the thing of oil?
So I don't personally ozonate oil. I buy because it can be a very combustible, and if you're not do it right, you can blow up your kitchen.
Big bubblers. So you can make home oil, ozonated oil and water.
You ozonated oil? Mom, you're such a rebel.
It's a bubbler.
Yeah.
The one you stick in the water.
Yeah.
Yeah, same thing.
Yes, but you have to be very careful when you're trying to do it in a concentrated form. You have to be very careful when you're trying to do it in a concentrated form. My mom's a rebel. She ozonated some oil, she's saying.
Olive oil.
Yeah.
And,
It's just messy.
Very simple.
Yeah.
There's the ozone generator small to clean everything. I clean my vegetable, my fruit. Okay, there's two heads, one for the water to clean the vegetable and fruit, and one for the oil. And I did ozonate oil, olive oil,
There's a lot.
Mhm.
and it is excellent for the skin.
So that's why you look like you're 25.
Concentration and dose of ozone is very, very important. So I believe for it to be powerful enough to, be in a jar that's going to last, to get to that periodontal pocket successfully, we have to use a very high concentration and dose to ozonate that oil. And that's when it can become a little bit combustible in that form. But yeah, ozone oil is one of the things that it's also great for sensitive teeth.
Sensitivity
Yeah.
is excellent.
Mm-hmm.
I did try, I had extraction from my son-in-law, and he gave me sensitivity for the molar close to it. And what really stopped that sensitivity is the ozone oil
Mm-hmm.
immediately. And I would like to say the ozone oil is used long time ago, even in the Middle East. Even they do it in very, very, very simple procedure, and they use it.
I'm just going to pass you that because the folks on Zoom need to hear that. Say that again.
Okay. I had extraction anyway. I had a sensitivity in one of my molar. I tried everything. Then after I said I want to use the ozonotic oil, I did, and it gave me almost immediate result for the sensitivity. And what I like to add for the ozonotic oil, it's used in Middle East for years, long time ago. And they do it in very, very simple way, very simple generator, and they use it for the skin.
Thank you.
I have the ozonated gel that you put on the gums. So, but when you hear that maybe you can't breathe ozone, how is that different when you apply it or something? You can't breathe, like that's.
So the two main cells in the body that don't have antioxidant capacity are the lung cells, because we need to be able to breathe oxygen without battling the oxygen, and the eyes. So it will not cause you any harm. It will just irritate the lungs a little bit, but that's mostly in a gassy form. The oil, it's an ozonide, and it's actually safe. So when some people need to have treatments for their lungs, they will actually bubble the ozone through the oil and have the patient breathe, because it then becomes an ozonide, which is a different form that the lungs can take in. So it's very safe. The oil is very, very safe. Yeah.
So I'm just conscious of time. I just want to have one question for each of you because it actually has to pertain to what we're saying, and then we'll open it up for Q&A because I'm sure you all have a lot of questions. But the question is, so if somebody, think about your clients, think about us as consumers, what do we need to be aware of, conscious of? There's home uses, there's in-clinic use, things, what's your thought process for us as consumers? What do we need to keep an eye out for?
Dasha, can I talk a little bit about ozonated saline? Because I didn't really mention that. And then I want to answer your question, but I wanted to mention ozonated saline. I think I briefly mentioned it when I was talking about the history of ozone. I mentioned that in Russia, the scientists and doctors there developed a method of administration. It's a systemic method. It's called ozonated saline. So it's similar to what we talked about ozonating water. So when you ozonate water or you ozonate salinated water, saline solution, it's not like putting it into blood or into tissues. For example, when you put ozone into blood, there's an immediate chemical change. The ozone is no longer ozone anymore. It turns into ozonides, peroxides, and other compounds. But when you ozonate water or saline solution, the water or the saline solution actually suspends the ozone. So it remains as ozone contained inside the water or the saline solution. So let me just mention about ozonated water. Ozonated water is fantastic. We drink it whenever we can in our clinic. But it's important to understand that it's not really a systemic treatment. It's really a local treatment because it doesn't get absorbed through the intestines into the systemic circulation. It really just treats the stomach, the esophagus and the stomach. That's about as far as it gets before it's not ozone anymore. So what does it do and what's it good for? It has amazing benefits for things like H. pylori infections. It can control H. pylori infections. So it's fantastic for things like that because it's still ozone. When it reaches the stomach, even for a brief period of time, it's still ozone, and it still has that antimicrobial effect. So now let's talk about ozonated saline. When you ozonate saline, again, you can now do a drip, an IV drip into the body. So when you ozonate the saline, it's still ozone within a saline solution. We introduce it into the veins. It's a very simple, safe procedure. When it gets into the veins, it immediately now interacts with the blood. It interacts with a larger volume of blood than major autohemotherapy. When we do major autohemotherapy, remember that's where we withdraw the blood, we ozonate it, put it into the vein. Typically, we're ozonating a relatively small quantity of blood, maybe 100 cc's, which is a bag like this. When we do ozonated saline, we have to expose the saline to the ozone for a period of time, 15, 20 minutes, so that it gets suspended inside the ozone, goes into the vein, and it actually still retains a little bit of that antimicrobial effect inside the blood. So we might prefer to use ozonated saline, for example, for viral infections. There have been studies that have been done with COVID patients, for example. In Spain, I believe they did these studies, and they found that it improved outcomes for COVID patients, and we believe that's because of this antiviral, antimicrobial effect that it has in the blood. So otherwise, though, I would say that ozonated saline does all the same things that major autohemotherapy does. It's just that we might prefer to use it in certain situations. We might prefer to use major autohemotherapy in other situations. For example, we would choose to use major autohemotherapy for an autoimmune patient because we're using higher concentrations of ozone, higher doses of ozone, and we wouldn't really want to do that with ozonated saline because it would have too much of an oxidative effect on the blood vessels. You could have things like phlebitis. So you don't want to be using ozonated saline in higher doses. We use very low doses for ozonated saline. It also has the benefit of being just easier, cleaner, and cheaper to do because of the equipment that's required is simpler. The procedure itself is faster and quicker, very clean. So we do a lot of that in our clinic. So I'm going to leave it there, but to answer the question about what people need to know, I would say the first thing that people need to know about doing ozone is that first go to a qualified practitioner who follows the Madrid Declaration. We didn't talk about the Madrid Declaration too much, but the Madrid Declaration has all the guidelines and dosages, and your practitioner definitely should be educated about that. Your practitioner should be using safe and effective equipment, an ozone generator that's resistant to ozone, obviously, and that has an adequate measuring device so that we know exactly how much ozone we're giving the patient. The other thing that I would say that's important to understand, other than going to the right practitioner, is that ozone is a little bit like exercise, okay? Exercise is also oxidative, and we know from our experience, when we go to work out, you want to get in better shape. You don't want to overtrain, and you don't want to undertrain. You want just the right amount of training, right? And you also know that if you go to the gym and you want to get in better shape, you're not going to go one time to the gym and expect to get results, right? It's conditioning. Ozone works the same way. It conditions the body to have this adaptation to it. So you have to go to ozone treatment with the expectation that depending on what you're going for, you're probably going to need more than one treatment. You're going to have to repeat it. If you're doing the systemic types of treatment, you're probably going to have to repeat it and not just do it once. So those are, there are other things, but those are the main things that I would say that you should keep in mind. Does anybody want to add anything to that?
What would you recommend for consumers to think about or have in their minds as they're thinking about ozone? Either for home use or for however they would use it.
Well, let's just talk my world, dental. Let's look into alternatives to drilling right away. Let's look into ways that we can help to prevent or give the body a chance to heal itself. And so I would say, ask your dentist if they use ozone, if that's even a chance. It's very safe, it's very simple, and of course, that they're trained properly, that they use medical grade oxygen when they're using it, and not to repeat what Dr. David already said.
And so if the dentist doesn't, then they should call you.
No.
Just call your dentist, call you.
No, but just to look into alternative ways, because the days of drilling and filling and just drilling and filling, there should be a little bit more thought to it, and to respect everybody, all of my peers, and to everybody that don't use ozone yet, just to think that the body is able to heal itself with a little bit of help, even the teeth. And guess what? The mouth is part of the rest of the body.
Stemming from our conversation earlier today. I really want to get to the Q&A, but one thing is ozone is very safe. Very, very safe. Now, the nuances are how, when, where, why, yes, but in general, ozone is a very safe modality when done correctly and with the right guidance and with the right practitioner. Also, to add to the fact that if this is an adaptation, which we are doing, we are tapping into the body's brilliance. Understand that if you didn't stretch, not that I believe in stretching so much, but you didn't prepare to go to the gym that day, or you didn't take care of yourself after you went to the gym that day, understand that your results are going to be very different. So knowing that this is a participation type thing where the provider should also be optimizing and supporting the body before treatments, after treatments, or giving guidance and how to do that. And understanding that, as with all things that I like to encourage, is this is your body, this is your experience, and to take on the responsibility of supporting these treatments. And then it's not like, oh, I have to go in for therapy. It's like, I'm going to do this to optimize the rest of my body like I am eating the right way and moving our body the right way and blah, 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 blah. So with that, autonomy and self, let's open maybe for...
Perfect. So just also we'll pass the microphones around for Q&A. So we'll do a little bit of Q&A. I know we're about up on the hour, but if people it's 2:30, if people want to stay and do some Q&A, ask any questions you may have for the Zoom as well. If you have any questions, then post them. If you're passed around the microphone, just keep it close to you and you guys as well, close up. So, question?
For Dr. Maya.
You don't have to push anything.
You don't have to push anything, just hold it like that. As if it's a microphone, you're just holding it, yeah.
And you are amazing.
Thank you.
I love your energy. Thank you so much for everything you're saying.
Thank you.
Regarding dental, so most of us have unfortunately had to have already the traditional type of dental procedure, whether a root canal or filling or whatever people have had. Is it reparable, too late? Can we, how much is too much so that we don't continue, or, because now I'm worried, of course, that I had a regular mainstream procedure when maybe I didn't have to, but I was told by 3 different dentists that yes, your options are root canal or extraction when you have this. That's all the industry knows at this point. Is it too late? Is it terrible? Can we still bring life to the mouth and be okay?
It's never too late. It's never too late. I think identifying interferences and making sure that the connections between the mouth and the body are made are very important. So thorough evaluation, identifying any interferences that might be there, and then deciding together with your dentist how you're gonna move forward. Are you gonna watch and wait and see? Are you gonna take action? And it's not everybody that has a root canal tooth gets all of their root canal teeth extracted by me. So we have to take into consideration the patient's specific biology, what they have going on, and then, make a plan based on what's going on with them. So no, it's not too late. Not too late.
I don't even know if I need this.
No.
So for Dr. Sienna, how young can someone get ozone? 2 years old.
It depends on what kind of ozone they're getting.
She's getting constant ear infections.
That's fine. I don't know if they're doing it on neonatals, though actually I think that they might, but no, pediatric, a 2-year-old even is fine. Blow by ozone, again, it's concentration, it depends on the concentration, where it's being localized, but no, they can, pediatrics is actually preferred for ear type things and sinus type things, because it is very, very safe, and as long as the concentration and the dose and all of that is taken into consideration, then absolutely.
And how often for anti-aging preventative, is it once a week? Is it, what would be the recommendation?
Patient specific. The easy way to answer that is probably once a month, depending
Once a month?
depending on if you're getting an EBU versus getting something that's less, I don't want to say concentrated, but if it's a one pass, you do it more frequently. But it also depends on where you are as far as right, yeah. So the general say you're not dealing with anything specifically, you just really want to kind of upkeep. If it's an EBU, I would say once a month. If it's a one pass or a 2 pass, then the frequency would be different.
Okay. And for the dentist, is a preventative, like when you go for cleaning, do you use it? What kind of preventative ozone could you use if you don't necessarily have an issue, but in a preventative way?
Yeah, we do ozone cleanings at the office. So it's in 2 forms, in irrigation with ozonated water at the end of the cleaning, or if there's a little bit more inflammation, but it's still a preventive, we do ozone insufflation with the cleanings. It helps with sensitivity too, and it feels really amazing at the end of that cleaning.
Excellent. You have cards, correct? Where's your office?
Thank you.
Do we have any questions on Zoom also?
I'm curious as to what type of treatment did Tom Brady have? He's very famous. He went to Europe once a month. He flew to Europe. He's 47 years old. He was still starting quarterback. He's a modern miracle, actually.
And he had ozone treatment
I
done?
believe so, but I'm not sure.
If you went to Europe, you probably did, but they have, I mean, it's a mainstay in European practices. But they're all, and there's a lot of different modalities that they are using.
Hyperbaric chamber is definitely.
Hyperbaric chamber.
Yeah, hyperbaric. Just one sec. Do we have any questions on Zoom?
Question?
Here, we'll just ask the question on Zoom for a second.
So the question is, can you please share some benefits of rectal ozone? Is there a systemic effect? And does it have any vagus nerve benefits?
So it was about rectal ozone, systemic effect, and
Vagus nerve.
is there any impact to the vagus nerve?
We both can probably answer.
Sure.
I do know there are systemic effects. They did some studies on, don't quote me on exactly who did it, but a team of soccer players, and they were looking for performance markers, and they were looking at the effect of ozone. And the form of ozone they did was rectal insufflation. And with a serial number of treatments, they found that those that got serial treatments of ozone had better performance markers. I don't remember if it was quadric strength or if it was a sprint, but their performance markers. So that shows a systemic effect. It also has a lot of local effect based on the high amount of your venous drainage in your rectum. But if you want to talk about that, we'll share the mic.
Well, I was going to talk more about the systemic, because if you want to finish. Well, systemically, it does have benefits. It definitely gets into the bloodstream. There's a lot of blood vessels around that area, and so it gets absorbed into the bloodstream. And so we see people, we don't do a lot of that in our clinic, but we do see a lot of people do it at home. So if we have a patient who needs to have ongoing systemic ozone treatment, they can't inject themselves, they can't do an IV on themselves. But what they can do is they can get a generator at home, and they can actually do rectal insufflation and treat themselves as often as they want. As long as they follow the guidelines, we teach them how to do it and what the dosages are. And as long as they're doing it correctly, it's a great systemic treatment. And it also can be used for children, where we might not want to do an IV on a child. We might want to instead do rectal insufflation. So we do use it for that. But definitely there's been plenty of studies done on using systemic use of rectal insufflation. I'm not as familiar with the local, so I'm going to hand this back to you. I don't know.
That I couldn't tell you either, but, well, I guess I can tell you for Crohn's, ulcerative colitis, as long as there's no contraindications for inserting anything in that area, if they're having active lesions or that kind of thing, it can have a local, again, a local antibacterial, anti-inflammatory effect for an irritated bowel. And I know they use it on pets a lot that way too, so if anyone's a pet lovers, they do that too.
Perfect.
Then the biggest nerve, they ask about that.
I don't have an answer on that. That would all be conjecture at this point, so, for me.
Yeah, I'm not aware of the effect on the vagal nerve, so I can't really speak to that.
That might be more of just the anal stimulation than anything else.
I have two questions. One is about the EBU. What creates the difference between the stress on the veins between EBU and potassium? Is it like the rate?
It is. It's that the pull rate is actually very minimalized, and we can control that. And I do sometimes if the vein is smaller or if the vein is not as strong as somebody else. So that, and we're not pushing back into the same vein, so it's a constant general flow. And so it is definitely less pressure on the pull.
And then my other question is, so we hear a lot about good microbes and bad microbes, especially in the mouth and in the gut. Is it killing both? Is it antimicrobial on both the good microbes and the bad microbes? And so how do you
Ozone kills everything. It kills everything. So what you don't want to do is rinse out with ozonated water every single day. It's the same thing as rinsing out with Listerine every single day. We do not recommend that. The best thing is to keep the oral microbiome in check. And as you guys already know, 40% of the oral microbiome is shared with the gut microbiome. So it's not something that we're going to recommend. Even if you're using the oil, you're going to use it in a specific pocket, in a specific area, depending on what you need it for on a specific schedule. So it will kill everything, ozone. So it's not something you want to use every day, like a rinse, for example.
I want to just echo that's an any form of ozone that we get, which is also why spacing things out and allows the body to adapt. Anything in extreme is not good for the body, including ozone. Okay, so in all forms of administration for ozone, that would go, in my opinion.
Yeah, great.
Has it been used for tinnitus? You've done that? And has it been effective?
Again, nothing in. Since we don't necessarily 100% know what is the cause of tinnitus, and there's a whole consortment of potential causes, from structural to mineral differences to things that are causing inflammation to viruses. I mean, the causes are very, very broad. So can it, for the right indication? Yes. Can it for all indications? No. But if the area is overactive because of a source of inflammation, or maybe there's a viral component or something along those lines, then it can help ease symptoms. But a lot of it, understand, since we don't necessarily know what is contributing to the symptom in general, it can't be a broad spectrum saying yes. But it can, if it is affecting the cause.
Safe enough and low cost enough to at least try
Exactly.
to see if it helps.
And that would be primarily a local, would give you a better effect.
And how about using it for, I missed the first half, unfortunately.
Dare you?
Sorry. How about using it for things like tendinitis and extreme tightness in muscles?
Absolutely. I know he has good.
Yeah.
Yes, but I know he's got good.
And how are you doing that? And just
Yeah.
really quickly, I want to say, I actually had ozone injected into discs in my back
That's what he
in
talked about.
2016.
Right.
Okay. I went from having a back that was a train wreck for 26 years
Yeah.
to having the same back I had when I was 17 years old. I was
Right.
told I needed surgery, you'll never run again, you'll never bike again, you'll never even swim laps again,
Yeah.
to being an endurance athlete.
Yeah. Yeah.
After how many sessions? One session.
One session.
We didn't pay him to come and sit here.
Just to be clear, it took 6 months to get there, but after 26 years, my back is totally fine. I bike 70 miles regularly
Gave
with
it what it
guys
needed to
20,
do.
30 years younger than me.
Yeah.
What's that?
You gave it what you needed to induce the healing process.
Yeah, and that's so
Yeah.
the beautiful thing is the introduction of ozone is upregulating your body's ability to
Exactly.
heal. It's saying, wake up,
Yep.
go there, do that.
With the right
You
signals.
did it.
Yeah. Yeah. I mean, it's,
Exercise and training and all that other self-supportive stuff.
No,
With
at
it.
that time, not at all.
Just
I hadn't been on the bike in 18 years, or at that point, 12 years.
yeah. No, I would say that, tendonitis is a degeneration of a tendon. We commonly use it for that. We'll inject it where it needs to be injected for muscular problems as well. So yeah, it's an amazing regenerative medicine that can be used if it's used the right way. It's one of the tools that we use to address things like tendonitis and muscle issues, joint inflammation.
Muscle tightness, if it's been like one's entire life.
Yeah, I mean, it depends. It's a case-by-case basis why you feel that muscle tightness. But it's usually not, honestly, it's usually not a problem with the muscle. It's usually a problem with the tendon. So we're looking at the tendons is where the muscle's attached to a bone, and that usually occurs in the area of a joint. So we're looking at treating around the joint. We inject ozone around the joint.
How do you feel about using it with PRP?
Yeah, we do. We use it with PRP. It works great. Yeah, it makes the PRP work better. That's another thing about ozone. It makes almost any kind of therapy work better.
I'll
So,
give you another
yeah.
testimonial. I was hit by a car while training 2 weeks before my first race in April, and I had sprains like my whole rib cage, my back, my neck, everything. I had a lot of different treatments, regenerative treatments, but PRP with ozone was super helpful.
Yeah, it's okay. They're synergistic, and they work great together. We do that a lot in our clinic.
I want to add it to that. It's something that we routinely use before a biologic of some kind because it kind of helps clear the playing field, as well as stimulating that stimulus to the area. So whether it's systemic or local, it is, as Dr. Pakula alluded to, or not even alluded to, but said, it is complementary and makes pretty much anything you're going to do better. Timing is an issue sometimes, at the same time versus before. It all depends on what we're trying to treat. But it is, and routinely done, and should be done before a lot of these other biologics, because that way, just like I said, you prepare for the gym, you're preparing the body for the chance to then go in and bring in other healing modalities. So that's my echo.
Great. I know we have 2 more questions. I'm just conscious of time. I'm just conscious of time, so we'll just take 1 and then 2 more questions, and then afterwards the doctors will be around. Also, for anybody who's on Zoom and anybody here, if you do anything with ozone with any of these doctors, it's a 10% off, and then for the month of August. And if you use HOCAT, which is our ozone sauna here, it's 40% off. So just be aware, take advantage of it. But let's have the last 2 questions and then we'll break.
I know that, that I could probably ask you this question separately, but for
might benefit
anyone in
from it.
here or the Zoom, you mentioned the cancer. And you also mentioned that it's for, building the immune system. So outside of building the immune system for anyone with cancer, what else can it do for you outside of that?
Outside of those 2? That was, we had like a whole book list.
That's it, that's good.
No,
Address that.
no, it because it can affect, literally, like you said, we didn't want to sound like a magic bullet, but it really can benefit any of our modalities because you're bringing things into balance. And what disease is an imbalance, even
Hormesis.
exactly. And it in the right situations. This is why we were saying dosing is so important. You're creating that hormetic effect. If that is too much of a stressor on the system at the time, any hormetic effect or any stressor that's hoping to do a hormetic effect is just too much stress. So that's why paying attention to having somebody who's actually a provider that is going to put the whole picture together and say, is this stress appropriate for the body at that point in time? Is it actually going to do what we want it to do based on the terrain of the individual and what our desired outcome is important. But it really can benefit everything.
I have something I can add to that. So there have been studies done on cancer patients that have showed that.
I just don't want you covering it.
Oh, okay.
You have to hold it like this.
Cool malfunction. So there have been studies done on cancer patients for those cancer patients who are doing traditional cancer treatments like chemotherapy, radiation therapy. Ozone has been shown in studies to make those treatments more effective and to reduce the side effects from those treatments. There are actually scientific papers and the studies that have been done. So how does it do this? You know, one thing is that it's increasing oxygenation, it's increasing blood circulation. So when you use something like chemotherapy, it's going to help the actual chemotherapy to reach the areas that it needs to get through better circulation. For radiation, it's having a regenerative effect on the tissues that are damaged by the radiation, and it's also helping the radiation work better. Side effects, it just makes everything less. People who are doing these treatments just report having much fewer and more tolerable side effects. So it's really a winner, and I wish more people knew about it, and I wish that the oncologist would be aware of it so that they could recommend it to their patients. But unfortunately, a lot of patients who come to our clinic say, my oncologist won't let me do that. They don't know what it is. They just don't know. Right? So
I really do want a lot of the oncologists out there to get a wind. But in my mind, cancer, we never make claims on anything, but is just on another spectrum of autoimmune, of disease, and all of that. So if we're help riding that ship and we're not doing harm to the body, we are supporting the body to address what is out of balance. And that is supportive of all things. And if you do have any one of those diagnoses, see a biological dentist first. See a biological dentist first. And we can, that's another talk. But yeah, there are a lot of studies that are showing that it's beneficial for all of those categories. And I agree. So.
One more and then we'll break.
So I support people with diabetes, and they do have a lot of concerns. And the major one is neuropathies. And you know that it's so hard to treat them. They always complain, what can you do for neuropathies? They can sleep, they can barely walk. Sometimes I know it's very good for healing the ulcers. But I wonder if there could be a possibility to help them with neuropathies. And also they deal with a lot of comorbidities like arthritis and some other issues. So I wonder if it helps in that area as well.
The answer is yes to all.
I'll add a little bit to that. So we use systemic ozone treatment for diabetes because it does regulate the metabolism, and it helps with metabolic diseases like diabetes. As far as the sores, you mentioned that, of course, we would use it for that. As far as neuropathy, honestly, ozone wouldn't be my first line treatment for neuropathy. I would use something like treatment with glucose. We call it, sometimes it's called glucopuncture or neuroprolotherapy or perineural injection therapy, where we're injecting a glucose solution around the nerves, feeds the nerves, helps regenerate the nerves. So do more of that than I would ozone.
But, yeah. But if you're looking also for systemic neuropathies or any of the arthritis, or something, that's again inflammation. And the neuropathy is a more, it's been going on for so long that it's constantly getting another signal. So it may not have I agree, not the first line for a local neuropathy, but for a systemic writing of the inflammatory process that's going on that's feeding the actual cause of the arthritis, of the neuropathy, of the metabolic dysfunction, and all of the other cascade. Those are downstream effects of a metabolic dysregulation and a chronic source of inflammation, which ozone can help for. So maybe not local first line, but definitely as a part of a treatment protocol when we're addressing the metabolic. So yes and no, but yes.
Wonderful. Can we just say something? And so I know that before we even get there, first off, thank you.
Thank you for allowing us to be here.
I hope, like I mentioned before, for any of these docs, if you want to work with them, it's 10% off for the next, for the month of August. And if you'd like to come into our clinic, we have the HOCAT, which is the ozone sauna, which if you have not experienced it, highly recommend you trying it, and that'll be 40% off. And Dr. And yeah, Advita Health also has an ozone sauna, so our partner there as well. So in terms of our next VHL Presents, we're typically starting to have these once a month. The next one is coming up on September 14th. Dr. Alfred will be here talking about hyperbaric oxygen therapy. Has anybody experienced hyperbaric oxygen? Great. For those of you who haven't, it's one of my favorite tools. When I had a brain injury, it was the thing that brought me kind of back to life, if you will. So highly recommend coming and joining us in September. But for now, if you'd like, join us for food, join us for chats, and if you have any additional questions for the doctors, they will be here as well. So thank you again, guys.
Thank you.
Thank you.